Thank you for participating to our course. I know I have a student from Vietnam, from Thailand, from Bangladesh, from East Timor. Right. And we hope by having this opportunity to work together collaboratively internationally, we can have a better chance of sharing on issues related to social determinants of health. I also want to welcome a student from Indonesia. Some are with me and some are distantly connected to us here. And we are very happy. Your participation would be very useful for developing awareness of the importance of social determinants of health in Indonesia, in Vietnam, in Thailand, in Malaysia, in East Timor. I hope by having this course we can produce something that useful for our countries, for our state, province or district. We are here to help the student to work on their own cases in social determinants of health. At the end of this program, that we hope student can produce a posters, a case study that will be presented about on March next year in our meeting in Yogyakarta. I think it is always good to start with what we mean by social determinants of health. If you look at the chart that I have shown in the screen, there is one point of understanding this picture is to look at the first two boxes. There is a medical doctors and patient in there. And the patient in that is our focus of analysis. In the medical setting, patient is treated as those suffering from illness. And from the perspective of medical doctors, this is what we usually call medical determinants of health. When patients come to doctors, doctors make a diagnosis and they solve the problem based on the doctor perspective or medical perspective. So medical determinant of health, meaning that the health problem is looked from the perspective of medical science. Now, what is the problem of the medical determinants of health? Now, doctors tend to focus only to the problem that make individuals suffer in that patient. Now, in many discussions, when people get sick, if doctor only pay the attention to the sick, we forget about the social condition that producing disease. I think it is good if I can sit here. Now, if doctor only treat the patient, who treat the cause of disease? The cause of disease basically can be several levels, but we at this time just focus on the social condition that make people sick. Now, this is the social determinants of health, which doctor cannot cope with them. So we need other sectors or even society to help themselves to make them prevent from the disease process. Now, let me show you another good example of the other thing. There is a non-medical determinant. If we say non-medical determinants of health, meaning the perspective where medical doctors cannot solve the problem. So it goes to the social problem around here. Some are still public health service. So individual determinants of health, another terms, is cover the idea that if someone gets sick, it is their factors, their individual factor who shape the disease. Now we can argue that sometimes we always blame individual for their sickness. Say for example, if someone smoke, they get lung cancer. This is individual determinants of health. But we can argue another way. It is not to blame the smokers, because the smoker has been shaped by the society to smoke. This we call it social determinants of health. Now our concern in this course is to change the mindset of individual or medical determinants of health into more social determinants of health. I hope with this, I think at the end, at the top one, we can see I call it, patient can be the victim of social factors that make them incapable to control themselves, right? But doctors so far, they don't have any attention on that. Now we are those students who are interested in social determinants of health, try to put into the context of the government policy, social movement, community development, to address the issues that doctors cannot solve the problem. That is the nature of social determinants of health. Now some other framework that World Health Organization have put it in different way, as you can see in the display. I don't want to go about that quickly, but you can look at the WHO literatures. Now basically they argue that there is a structural determinant of social determinants of health inequalities and intermediate to one. What we are doing is this part. This is the different way of figuring out the problem of social equity. So what we expect, that why we are here? We are here, firstly, we live in the countries where the social determinants of health are neglected. So we are part of the student want to voice out the problem of social determinants of health victims. The second one, we want to make a group of students who advocate the government policymakers to address this issue in their policy making process. And by the time we finish this course, we hope that we can get in touch with the policymakers and also get in touch with the society where the problem is there. Thank you.